is Health Talks. I'm Dr. Joshua Dirito, a family physician. I have interests in cancer prevention and treatment and public health. In this video, we are going to look at the importance of regular health checkups. Prevention is better than cure, and your health is your greatest asset. So in this video, we are going to look at some of the importance of regular checkups and why it is important. So we are going to look at what are health checkups, what are the benefits of regular health screenings, common checkups for different age groups and different risk factors. We are also going to look at ways of overcoming barriers to regular checkups, and then we are going to do what can we do to improve our health and also adhere to regular checkups. So what are health checkups? These are routine medical examinations to assess your overall health, helps to prevent diseases and detect early signs of diseases before they become complicated. There are different types of checkups. You have the general physical exam where you present to a doctor. He takes a history about yourself. He knows whether you have any family history of any medical conditions. He will take a history of what allergies that you have, what are some of the common conditions that you have had in your family lineup, and what are some of the medical complications that you have had. And based on this, he can be able to decide which would be the best medical blood test that would be appropriate for you. So you can go through blood tests like test for cholesterol, test for your blood sugar, check your kidney and liver functions, and other tests depending on what the doctor finds from your history. Then there is also cancer screenings where we talk of tests like the mammograms. You can have pap smears for ladies who are between the ages of 21 and 65. You have colonoscopies both for men and women, and also you have heart checkups where you can do an ECG, which is an electrocardiogram. This is a picture of your heart and it shows the rhythm of how your heart is beating. Then there is also the physical examination where you can have your blood pressure checked and your blood sugar, and you can also have your body mass index determined, and this will help you and guide you on how your nutritional status is, what are some of the risks depending on your body mass index that you need to take. So what are the benefits of the regular health checkups? One, there is the aspect of early disease detection. So if you find you have any health issues, they are detected on time before they become serious. Then there is the aspect of preventive care. There are the vaccinations. In one of our previous videos, we have talked about some of the important vaccinations. Of course, there is the childhood vaccinations, but there is also these vaccinations like for flu, for those who have various immunocompromised. We have vaccinations for human papilloma virus for ladies between the ages of 10 and 14 years, which help to prevent human papilloma virus infection, which is the virus that is associated with cervical cancer. Then you get also advice on lifestyle modifications. If you've been a smoker, then you'll be advised on how to stop smoking. If you have not started smoking, then you'll be encouraged. Are you having regular exercises? What is your diet like? And this will be an opportunity to give you appropriate diet advice on how to stay healthy. And then there is also the risk assessment. Risk assessment, remember our genetics, we get it from our parents. They say that genetics loads the gun, but it is our lifestyle that pulls the trigger. So we might be at risk of particular diseases because of your genetic composition, but how you live your life will decide whether you get the conditions. Then there is also the issue of monitoring chronic conditions. If you have conditions like diabetes, hypertension, and if you have abnormal cholesterol, when you do a healthy person checkup or healthy checkup, then these conditions, how you are progressing with your medicines, what problem are you having with the drugs, are you having any drug side defects, are you developing any complications from the disease? Because the truth is, some of the conditions like hypertension, they cause heart failure, they cause heart attacks, they can cause a stroke, and this does not just happen in a day. It's a process, and it takes many years. So when you go for your regular checkups, your doctor is able to look at you, look at how you have been managing your drugs, are you having any drug side effects, and be able to advise what we need to adjust. If you have diabetes, is your sugar well controlled? If you have abnormal cholesterol, what can you do lifestyle wise, diet wise, to make sure that you are in the right track? Then you can also have mental health checkups, which identify stress, anxiety, and depression early. Sometimes having chronic conditions can also lead you and predispose you to having stress, and this can be managed so that you can live longer and you can live healthier, and then longer, healthier lives. So when you know how is your health status, there is that aspect of improved overall well-being through the preventive care. So what are some of the common checkups that we have for the different age groups? We have the children and teens. Usually we do growth tracking. Is their growth normal? Are they getting lower weight than is expected? Are they also getting overweight? As these days we are also getting obesity starting from childhood, and so some of these things can be checked at childhood, and the parents given the necessary advice on how to adjust the child's diet. Then vision and hearing test, and also making sure that the child is up to date on the immunization. We have the young adults between the ages of 20 and 30s. You check their blood pressure. Remember these days that we are having young people developing blood pressure. I have seen a lady at the age of 26 and quite a number of other people with high blood pressure as early as in their 20s. So it's important to check for this. You can check the cholesterol among this age group, have skin checks, and also check their reproductive health. Some of the commonest problem around this age group is related to the reproductive aspects. Then you have the people in the middle ages, 40 to 50. Usually here is the cancer screenings, diabetes tests, and even heart exams. The screening test will include doing a colonoscopy to check whether you could be having colon cancer, or us just making sure that your colon is healthy, so that if there are polyps, which could be the precursors of cancer, they can be detected and removed. And just giving you that peace of mind that everything is okay helps you to stay healthy. Then for ladies, you can start doing mammograms from the age of 45, and also the pap smears. Then for the seniors above 60 years, you can do the bone density test, cognitive test to check whether someone could be developing dementia, and also comprehensive wellness checks. This would be very important. So many people do not go for health checks for many reasons, and we have various reasons or barriers that people have for not getting regular health checkups. So some people will say, I feel fine, so I don't need a checkup. And this is the common mantra that many people will say, I don't feel sick, why should I go and see a health professional? But remember that many times that you have hypertension, many times your sugar might be high, it might not have any symptoms. Many times you are getting complications of the hypertension, you will not feel it, and the time that you present with symptoms, could be a little bit late for any interventions to be done. Then the aspect of many diseases show no symptoms until later stages. So prevention is key. So don't wait until you have symptoms that you start looking for health care. Some people feel that regular health checkups are expensive. The truth is, treating diseases is very expensive. And if you can change lifestyle and avoid taking the diabetes drugs, that would be a very good thing. Why don't you go for the sugar test, which is very affordable, and that will help you change your lifestyle. Then you'll find that even many of the screening tests are covered by insurance companies, and they might not just be affordable. It's only that we have the fear. Then there is the issue of lack of time. health checkups are an investment in your long-term well-being. So it is important that we prioritize your health. If you have a car, when it reaches its mileage for servicing, whether you like it or not, you have to take it. Otherwise, one of these days you are going to sleep on the road because the vehicle is going to break down. It's the same thing with our bodies. If you don't go for the health checkups, one of these days you are going to be grounded because you either have a heart attack or you have a stroke and you have to go to hospital. So why not take yourself when you can and just create an hour for yourself and stay on track. Then as fear of bad news. Remember, early detection increases your treatment success and the knowledge empowers you. We are talking about simple things. You might just go for a checkup. You find that the only thing that you have is your weight is above what is normal for you, and then you are advised on adjusting your diet. This is very doable, rather than go at a time that you will be told now your situation is out of control. You need to start blood pressure medicine, or you need to start diabetes medicine, or your cancer is advanced. Now we need to take you to palliative care. We do not want those kind of news. Even as doctors, we are not happy to deliver those kind of news. We want you to come to us so that we can help you live better. And giving preventive health is far much better than even the curative aspect of medicine. So even for those who are sick, don't fear to come, because we will still take care of you. But for those who are well, please also come so that we prevent illness. So book your next health checkups now. Let's stay informed. Let's spread this awareness. And if you are watching this video and you have watched us this far, I would like you to subscribe and share and like this video, and also share your comments. If you have done a health checkup, what made you do one? If you have not been able to do one, what are the things that you fear that make you not go for one? So that we encourage each other and we learn together. And also, what are some of the things that you think or you feel should be improved in the healthcare system, so that more people can come for health checkups. Thank you for watching. Stay tuned.